Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey there, welcome to the Stay Healthy El Paso podcast. I'm your host, Dr. David Midoff, specialist physical therapist over at El Paso Manual Physical Therapy. And today we're going to be talking about the 3 home remedies that we frequently give our clients that are coming in for treatment for tennis elbow. Now I'll talk about tennis elbow as well because it's kind of a confusing diagnosis. Not many people in the medical field really understand it or know what to do about it. They usually just throw in medications and braces at it and wish that it gets better, or they're hopeful that it gets better. But there's some very strategic treatment options that we put our patients through to ensure that it gets better and give them the control on making sure that it doesn't come back so that they can get that long-term relief. So tennis elbow is an extremely treatable thing. It shouldn't be recurring. And if you are one of those few people that really are playing tennis and have tennis elbow, we'll talk about that as well, so that you can know what to do about your tennis elbow situation. Some of the main reasons that tennis elbow comes up is, number one, a joint problem. At the elbow right here, you've actually got 3 different joints that all make up the elbow. One is the hinge joint, the one that, bends your elbow back and forth. And then the second one, you've got a joint between one of the wrist bones here, the forearm bones, and the upper arm bone that allows your hand to turn over, up and forward, like where you can turn your palm up and palm down. And then you've got a joint between that bone that rotates so that you can turn your palm up and down, and the other wrist bone, the other forearm bone right here. There's 2 bones, the radius and the ulna. So between those 3 joints, usually the joint that's closest to the outside of the elbow, right about where the tennis elbow hurts, is tender. And if you can find a spot right outside your elbow, not on the pointy part of the elbow, but kind of on the outside more so, where it's a little harder, if you can poke a spot in there and find a specific spot where it hurts, that's usually a joint problem in the elbow that's causing your tennis elbow situation. So the joint is what's frequently bothered in that spot. Now they call this tennis elbow because oftentimes tennis players get this, especially when they're doing a backhand swing, whenever they're reaching across their body and hitting the ball forward from the opposite side of their body where their arm's at. When the ball strikes the racket, the force of the ball hitting the racket overstretches the outside of the elbow. And if that happens repeatedly, like somebody might, whenever they're playing lots of tennis, it irritates the outside of the elbow. And it's just a matter of getting the joint happier. There's different things to do for that. One is letting it rest. Another one is aligning the joint properly. And then it could also be a strength issue that's feeding into the joint alignment issue. So all that needs to be addressed and looked at. And that tennis elbow problem will go away. Another big reason for tennis elbow is a nerve problem. There's a big nerve called the radial nerve that passes right around that same area where the joint is. So if you can't quite find a spot, if you're feeling your elbow and you can't pick a spot where it hurts, it feels more spread out, what we call in the medical field diffuse. It's kind of all over the region. Usually that's more of a sign of a nerve problem. And another telltale sign that it's a nerve problem that's causing your tennis elbow issue is if you also have problems up in the shoulder and going down into the forearm or even into the hand. Oftentimes that's a sign that the entire nerve is actually flared up. It's just most flared up on the side of the elbow. And your doctor might tell you that you have tennis elbow, or if you Google stuff on the internet, anything that hurts on the outside of the elbow is generally called tennis elbow. They just call it that because of the whole tennis situation. But there's multiple reasons for it. A third reason that you might be getting pain on the outside of the arm is a muscle imbalance. Now, in this part of the elbow, on the outside of the elbow, you've got a bunch of muscles that overlap that area and attach to the end of the upper arm bone. They're the extensor muscles of the wrist and hand. So the muscles that open your hand and allow your wrist to move up, like the back of your hand move up towards the ceiling if you're going to lift it. Those muscles all help to stabilize the joints there, and if they're irritated, you can definitely get what's called tendonitis on those muscles. And in order for that to calm down, usually it's just a matter of resting the elbow. So if you're a true tennis player and you're having this problem, you might have to back off of doing so many backhands. You might have to practice using your forehand. Doesn't mean you have to stop playing completely unless it's super irritating. You can't even swing a racket forehand, but you might just back off from doing so much backhand. If you're not a tennis player, then you have to think of what activity is setting off your elbow, especially if there's some sort of repeated activity. Like oftentimes we see this in people that are doing construction. Not necessarily construction workers, but people that are more so doing some construction on the weekend or evenings at their home, some temporary construction work. We've got clients in here that said that they're building furniture at home. They're making an addition. They're hammering in a lot of nails or using a screwdriver quite a bit or using power tools that require a lot of stability from their arm. That can set off that outside elbow pain that they call tennis elbow. And it might just be once that project's over, if they take a break from it, that it calms down. And if the project's over or they're still hurting, then they're looking at potentially taking some extra steps to make sure this problem goes away for good. So let me tell you those steps to take. Here are the 3 best home remedies that you can try at home for tennis elbow. Number 1, get a brace. There's tennis elbow braces out there. Now, let me just tell you the caveat with this. It's not going to fix it for good. It's just going to allow you to stay in a little bit longer, to do that activity a bit longer, for it to not hurt so much as quickly. There's tennis elbow braces, and they're usually just a strap that go around this part of your arm. Some are more like a sleeve where they actually cover the top of the elbow and the bottom of the elbow, kind of like a knee sleeve, except it's for the elbow. Those can help in making your tennis elbow situation just calm down a bit. But what I want you to know is that I wouldn't want you to go get a brace and think this is going to fix my tennis elbow problem. Like it's going to go away for good. This is going to be the best $20 I ever spent on this brace. It's just not reality. That brace is just going to diminish the pain a bit. And the cool thing about it though is that it might prevent you from having to take pain medications if you've been doing that, which saves your organs, especially your liver and your kidneys and other organs. So you want to make sure that you just use this properly, but the braces can make a difference. The second thing you can do is ice. I haven't had many patients come in and say, I can't think of one actually, that have come in and said that heat helps them. And what I typically tell patients is ice or heat might help different situations, but consistently with people that come in with tennis elbow, they say that ice tends to work best, and that they try heat and it didn't work for them, didn't do much. Not necessarily made it worse, but it just didn't help. But ice made a big difference. My theory on that is the joint, if it's a joint problem or a muscle problem, it's so superficial right here in this part of the elbow that the cold from the ice can penetrate a lot easier. So it's just more effective. But all you have to do is get an ice pack. They sell them at the grocery store. You can get a bag of ice cubes from your refrigerator, your freezer, and maybe just put a thin cloth around it if you want, and just put it right on your elbow and leave it there for about 15 to 20 minutes, generally until the skin goes a bit numb. That's how you know you've had the ice on long enough, but be careful not to get any ice burns. That's a thing. You can actually burn your skin with ice. And then after you've done it for 15 or 20 minutes, so take it off for another 15 or 20 minutes and then put it back on and cycle back and forth like that 4 times. So generally about an hour and a half to 2 hours is what it should take you. That usually calms it down a good amount so that you can sleep at night, so that you can avoid taking pain medications and maybe even skip a trip to the doctor where they might give you an injection. The third home remedy, and this one I think is really more of the long-term fix, grip strengthening. Go out to the store. A sporting goods store works great, even like a Walmart or a store that has a sporting goods department, and find yourself a grip strengthener, the type that has a spring on it and you squeeze it. What you would do is on that side that you've got the tennis elbow problem, squeeze it and hold it for 10 seconds, and it should really put a lot of strain on this part of your arm, on the inside of your arm where the muscles that close your hand are. Hold it for 10 seconds and release, and I would be doing that hourly if you can. I do maybe 5 to 10 grips where you just hold it for 10 seconds every hour while you're awake. Take it with you in the car, take it with you to work or school, and just squeeze the heck out of it. And the more you do that, generally it fixes a muscle imbalance problem that sets up the joint to be in a better position, and those muscles that are possibly, you have tendonitis in them, it'll allow them to calm down. Now, if you are gripping that gripper and it's actually hurting the outside of your elbow, reduce the intensity. Some of those grippers are adjustable, just reduce the resistance down, or don't grip it so hard, or do it less frequently as well if you feel like the more you do it, the more it hurts. So find the right intensity for you, but generally grip strengthening is excellent for tennis elbow problems. And if you're an actual tennis player and you're getting this issue, then strengthening your grip increasing your grip on the tennis racket is generally going to help you out whenever you're performing those backhands. So once the tennis elbows flare down and you're getting back into doing your backhands, make sure that you're thinking about tightening up your grip slightly on that tennis racket so that you can make sure to preserve the stability of your arm. And outside of playing tennis, it's going to be a good idea to go do some weightlifting, especially with barbells or dumbbells, because they have bars, kind of like a racket, and it's going to strengthen your grip the more weight that you lift with those barbells or dumbbells. So it'll translate to better performance, more stability in the elbow joints whenever you're playing tennis. Well, thanks for listening to all the stuff that I have to say about tennis elbows and all the home remedies as well. I hope that this was beneficial for you. If you're suffering from a tennis elbow problem and you're thinking about getting help for it, please give us a call at 915-503-1314. You can also visit our website at epmanualpt.com. That's epmanualpt.com. And you'll find exactly how to contact us there. The best thing to do is to go to the cost and availability tab and click on that so that we can begin to get some information from you, and one of my staff will call you back right away once you submit that info so that we can talk to you about your tennis elbow situation. Most importantly, start doing these remedies at home. Try the brace, try icing, and start on that grip strengthening. Go, if you're driving right now, make a quick stop at Walmart or one of the sporting goods stores to pick up one of those grip strengtheners. They're relatively inexpensive. You should be able to find one for not more than $15. I've seen plenty under $10 even. And that's the best money that you can spend to fix your tennis elbow problem. More importantly than the brace, in my opinion, the brace is more so for avoiding the medications because it will give you some relief. Same with the ice. So anyways, if you thought this was helpful, please drop us a 5-star review on whatever podcast platform you're listening to this on. We love getting those reviews just because we know that we'll get pushed out to more potential listeners, people that need to hear this type of information so they can get the relief that they're looking for. I don't care about the review for myself. I mean, it's great and all, but I really care that people are helped out. So please leave us a 5-star review for that reason. Thanks so much for listening, guys, and we'll talk soon again. Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.